All right, it's weekend and happy weekend to all our PsorPhil weekenders. Of course, by the way, I am Coach Joms, your host tonight, and let me introduce to you my two lovely co-hosts. All right, so I do have here Robelle Tanangunan. All right, she is from the group of Pearl, the group of the people with lupus condition. Tama po ba yun, Ma'am Robel? All right, and I also have here Dr. Weng. So she's also from the group of patients or also have the skin condition like us, the scleroderma. Is that correct po, Doc Weng?
Yes, that's correct.
All right, so yun nga po pala mga Sorfil Weekenders. So right now, so it's our 34th episode na nga and I know everyone are so excited with our topic tonight. And alam ko po ngayon we are quite skeptical nga, di ba, when we hear the COVID vaccine. So right now, we're going to clarify every misconception na naiisip natin. And right now we're trying to address that as soon as possible because mamaya nga po Ma'am Rubel and Doc Weng, we will have an expert to join us to discuss this. And by the way, our topic nga pala yon, 34th episode, it's COVID vaccines, lupus and scleroderma. Ngayon,
Sobrang
sa
hot
ating
topic.
sobrang hot ng topic. That's perfectly correct po. So, of course, sabi nga nila, di ba, it's online and people are really open to collaborative effort. We may have the different interests, we may have a different goal. Hulog na yung mic ko sa sobrang excitement ko. We will have the different interest and group, but we have the same goal, and that is to educate the people that they should not be skeptical, hindi sila maging half-hearted. Dapat tuloy po sila na pagdating sa pag-take ng COVID vaccines. Anyway, I tried to introduce myself. Let me just also give, of course, the chance naman to Madam Robel and Doc Weng to introduce. Maybe let's start with Mama Robelle Tanangunan.
Good evening, Joms. Good evening, Doc Weng. I'm Robelle from People Empowerment with Arthritis for Arthritis and Lupus-inspired Advocacy. So, sobrang thank you to PsorPhil for this opportunity to educate our patients. Hindi nyo alam kung gaano ka-importante sa ating lahat ito. So, thank you.
All right, thank you po, Ma'am Robelle. And maybe also hear from Dr. Weng.
Hello, good evening, everybody. I am Dr. Rowena Sia-Ortiz. I'm from the Scleroderma group under Scleroderma Society of the Philippines and as well as Scleroderma Awareness.
All right, thank you so much, Dr. Weng. If I may ask, are you excited about our topic tonight?
Oo, Joms. Alam mo, dito sa pag ikaw yung nasa advocacy, ikaw ang parating tanungan, pag hindi mo alam kung anong isasagot, dahil ikaw mismo may tanong din, 'di ba, Doc Weng? So, napaka very relevant talaga itong topic natin tonight.
Tama po kayo. And right now, of course, since we are on the same umbrella, I can say that kasi lahat naman tayo, we have the skin condition, pero magkakaiba nga lang tayo. But we have the same goal, that is to spread awareness to all the patients na kaparehas din natin. And this is really the perfect platform for them to be educated about our topic tonight. So, Ma'am Weng, if I may ask po, can you also share to us, kasi I've heard that you also have a group, tama po ba? Can you tell us about your advocacy or ano po bang ginagawa niyo po sa group niyo sa Scleroderma Awareness Group? Tama po ba ako if yun po yung name ng group, ma'am? Doc Weng?
Opo. I'm a member of both the Scleroderma Society of the Philippines as well as meron kaming Facebook page, the Scleroderma Awareness Philippines. So our main advocacy is, as you said, para mag-raise tayo ng awareness sa scleroderma.
All right, thank you po, Dr. Weng. So, may we also hear from Ma'am Robelle? Could you share us about your organization, what you do, what's your advocacy din sa organization niyo sa PAPSI po?
So, Lupus Inspired Advocacy is part of PAPSI, or People Philippine Alliance of Persons with Chronic Illness. So, pag sinabi natin chronic illness, these are conditions kung saan nasa atin na, and we are going to live with it for a long time, for the rest of our lives. So, with PAPSI, with the help of Sir Joseph of PsorPhil and Doc Liza Martinez. She's an advocate for human rights. So gusto namin na yung mga patients with chronic illness, they get to also know their rights as persons with disability. They get to also know kung ano yung pwede nilang, kung ano yung mga proteksyon na pwede nilang makuha mula sa ating government na kailangan naman at nararapat naman para sa atin.
Robelle? All right. So, nakikita natin, di ba, their heart of these two lovely co-hosts ko tonight on, siguro hindi sila yung tipong, not just an ordinary leader, but actually extraordinary leaders that are doing extraordinary work to help those patients like them, like us. Tulad ng sinabi ni Ma'am Robelle, di ba, they're also seeking assistance from the LGU on how they can, how they can support properly, syempre yung mga members din nila sa organization. So, Ma'am Weng, if I may ask din po sa inyo, I know na sabi niyo po, kasi there was a time that we had this little interaction. You mentioned that you are from Marikina and you are aiming to have to spread your chapter all over the Philippines, and kahit paano to follow the footsteps of Sir Joseph on how what are the things he did for Psoriasis Philippines. Right now, nabanggit nyo po ata like you are already 100. Tama po ba yon?
Yes, tama po. Sa Scleroderma Awareness Philippines, we have around 150 members. Pero dun sa Scleroderma Society, we have less than 300, almost 300. And yun nga, tama ka, ang ginagawa naming pattern, ako personally, yung organization nyo under Sir Joseph. Kasi ako, I'm very impressed kasi maganda, organized na, ganda na yung system nyo. So, hoping kami na one day, magkaroon din kami ng ganito. Kasi sa ngayon, isang group lang kami. Kay Manila siya, kay Luzon, Visayas, or Mindanao. Unlike your group na meron na kayong small chapters na meron ng Manila, meron na sa Visayas, meron na sa Mindanao. So, hopefully, in time, with little steps that we take, ma-achieve din namin konti nang na-achieve na ng PsorPhil.
Alright, so thank you po, Dr. Weng. As for our viewers po pala, as you may know, Dr. Weng is actually a doctor of dental medicine. She's a graduate from University of the East. Tama po ba, Doc Weng?
Opo, tama po.
Ayun, so she is currently, if I believe, kayo po ba yung yung pinaka-leader or the president of the Scleroderma Awareness? After the previous po?
Opo, bale sa Scleroderma Awareness, isa ko sa admin, saka sa editor. Tapos ako yung parang ngayon, ako yung pinaka-vocal na willing magsalita. So whenever somebody needs the speaker about scleroderma, ako po yung nagsasalita.
So kayo po yung talagang kumbaga kayo yung spokesperson ng
Opo.
Scleroderma Awareness of the
Ako
Philippines
yung
po. No?
madaldal na miyembro.
All right. How about you po, Ma'am Rubel? Right now, I would like to ask din, 'di ba? I know you have a lot of members din sa PAPSI, sa Pearl. If I may ask po, can you give us kung lahat ba or did you already conduct a survey kung lahat ba willing mag participate when it comes to COVID vaccination po?
Actually, we didn't have a survey, pero based dun sa mga questions na nare-receive namin from our Facebook page, so very, very interested sila to um, know if they are allowed to have the vaccine. Kasi number one, alam naman natin lahat na all lupus patients or autoimmune diseases are immunocompromised. So, ibig sabihin, number one na pwedeng tamaan at maging severe ang kalalabasan ng COVID infection is sa ating mga patients na umiinom ng mga gamot na nakakapagpahina ng resistensya. So, kaya hindi sila makalabas ng bahay, hindi nila magawa yung mga trabaho nila and all that. So, very, very interested sila kung ito bang vaccine can really help o kasi siyempre kung dun sa mga normal nga may mga questions pa, lalo na sa atin na may mga nararamdamang sakit at umiinom ng gamot.
All right, thank you. Thank you so much po, Ma'am Rubel. And right now, syempre, itong online platform natin, itong live stream, for me, this is really the perfect way for us that somehow amusing on how we can educate the patients like us. And let me also grab this opportunity to tell our viewers that this month is an autoimmune disease. Tama? So there's really something that we are celebrating right now. And malamang ang viewers natin, medyo ang daming naglalaro sa isip nila. Scleroderma, lupus. Karamihan ng, di ba, when we posted in our page, most of them definitely are psoriasis patients. But we would like to know more about you naman po. Maybe we can start with Doc Weng. Can you tell us about scleroderma po?
Yes.
Or brief, ano lang po?
Brief definition. Scleroderma can be defined as from the two words sclero and derma. Sclero meaning hard or matigas and derma pertains to the skin. So literally, ang sakit namin, matigas na balat. But there are two the classification or types, yung diffuse, local and systemic. So yung systemic can affect the internal organs. Kami, ang scleroderma, talagang hindi siya gaanong kilala. Ako, marami na akong instances na nakikilala ko ng mga tao. Pag nalalaman nila na ang sakit ko scleroderma, lagi akong tititigan na parang, ano? Ang hirap nang sabihin, ang hirap pang ispelingin. Kaya ang kadalasang ginagamit ko, sinasabi ko, pinsan or kapatid siya ng lupus. Yun.
All right, thank you po for educating us. Maybe minsan 'di ba there's really an argument on or comparison pag nakita ng scleroderma and at the same time yung psoriasis. But right now, I would also like to know more about lupus. Now, may I hear from Ma'am Robelle? Could you tell us a brief description about lupus naman po?
Well, pag sinabi mong lupus or systemic lupus erythematosus, it's a classic autoimmune disease. So, dahil systemic, so ibig sabihin head to foot pwedeng maapektuhan. Pero hindi ibig sabihin nun na lahat ng parte ng katawan maapektuhan. So, meron siyang pinipili kung ano yon ang pwedeng maapektuhan. So, usually merong rashes, arthritis, pwedeng magkaroon ng problema sa kidneys, pwedeng maapektuhan ng brain, ang heart, ang liver, ang kidneys. Pero ang importante with lupus and any other autoimmune disease is number one, ma-detect kagad, ma-recognize kagad ng doktor na ito ay isang sakit na autoimmune, and pangalawa, maging tama ang gamutan dahil hindi naman ibig sabihin na meron kang autoimmune disease matatapos na yung buhay mo. It's just that kailangan ma-manage at ma-treat ng maigi at tama at magkaroon din ng magandang relationship sa inyong doktor para lahat ng mga sasabihin ng doktor nyo, susundin nyo, tsaka well monitored and regular check-up.
All right, thank you so much, Ma'am Robel. And right now, of course, ngayon, most of our viewers, kahit pa paano natututo na rin, hindi lang about psoriasis. At the same time, they're also learning from scleroderma and lupus. And most of our viewers right now is, di ba, it's, nagtataka na rin, kung ano ba to, paano ba ma-compare. But right now, they answered it ngayon. Sana nagkaroon ng clarification. But more than that, more than these two lovely and beautiful co-host ko, they are empowered women. So this month we are still celebrating International Women's Month, right? And of course, part of that is ini-empower niya yung group, yung mga group nila or yung organization. Us here in Psoriasis Philippines, apart from empowering our members, we have this project that we are all looking forward to, and we're all praying na sana maisakatuparan siya. This is the draft of the psoriasis bill, the National Psoriasis Care Program that we have submitted to Congresswoman Helen Tan. So ayun, this draft is actually includes the monitoring, the diagnosis, the treatments, rights, the social protection, lahat para sa mga fellow kabalat. So anyway po, of course tuloy-tuloy pa rin po Ma'am Robel, Doc Weng, just so you know, we have this patient rescue program that we are continually working and supporting. Actually, we started with few patient rescue ng start ng WWP, but right now, as you may know, actually kanina lang din may nadagdag na naman po kami patient rescue that we will try to do our best to help them, and we can do so much, and we are knocking at the doors of your heart to our viewers. You can send your donations. So we're going to flash that on our screen, the options where you can send it. You can choose from the bank, the PayPal, GCash, and PayMaya. All right. Now, apart from that, also you have other option. Okay, you may donate a minimum of 1,000, and you will actually get weekends with PsorPhil tumbler for a cost. Okay, so that's our actually way of us giving you a token of our appreciation. So sabi nga nila, di ba, nagka-tumbler ka na, nakatulong ka pa. Apart from that, apart from the minimum of 1,000 getting the tumbler, you also have other option that is a minimum of 300. So should you wish to donate a minimum of 300, you're going to receive our exclusive t-shirt with our 2020 theme, Be Informed, as our token of appreciation. So we're going to flash on screen. So as you can see on our screen, the contact numbers where you can arrange kung ano po yung gusto nyong way on how you can donate through the bank, through the option that we have given you, or you would like to get the tumbler as our token of appreciation, or the t-shirt. Now, speaking of the t-shirt, actually, magkakaroon kami ng game. So, we're going to throw you a question. So, sa mga viewers natin, tutok lang po kayo because meron kaming amazing surprises for you. And one of that is t-shirt na ipamimigay namin. Okay? So, to our viewers, I know a lot of comments are actually raining sa nakikita ko. So, just please continue to like and share our page, and please use our official hashtag. Kung i-share nyo man to sa page nyo, sa wall nyo, sa group, or kahit saan man, use our, actually not really not just one official hashtag, but we have 4. We have the WWP COVID vaccine. We have the WWP autoimmune disease. We also have WWP lupus. And lastly is WWP Scleroderma. So as much as we would like to read all your comments, we're going to give you a 5-minute break. At pagbalik po namin, one handsome, kung meron akong 2 lovely co-hosts right now, there's one handsome doctor is going to join us, is going to educate us about the topic for tonight. So wag po kayo mawawala. We'll get back after 5 minutes.
NCD, the non-communicable disease, takes more life than anything else. 71% of people die of NCD. It's even higher with the low to middle income countries like the Philippines.
Psoriasis is one of the risk factor that can develop into non-communicable disease like diabetes and cardiovascular disease.
I am living with psoriasis for almost 19 years. Psoriasis is more than skin dip. I saw it spreading all over my body. And then when they told me that it is psoriasis, I asked myself, what is psoriasis? And then when they told me that it is incurable, my life turned 360 degrees. I don't like to go out anymore. And I'm worried that my sons will get it too. It's devastating. My husband has the biggest role.
I want her to be happy, to let her feel that I'm really supporting her.
He's the one introduced me to Psoriasis Philippines. Every one of them has the disease that I have. So I feel that I found the place where I belong.
Psoriasis Philippines as an organization has been very lucky to have as many volunteers in the forms of patients themselves. IFPA is our umbrella organization. They teach us how to talk to the government. They teach us how to lobby. They teach us how to ask for the things that we need. Psoriasis Philippines and IFPA share the same vision that no human must suffer from psoriasis.
Here in Rizal Medical Center, we have partnership with Psoriasis Philippines. Our goal is really to improve their quality of life. Awareness is very important. People will think that you are infectious. Psoriasis is not a contagious condition. It will eventually develop comorbidities. That's the reason why we are really advocating early management of psoriasis. The problem is access to medicine. Usually the kind of patients who come over are the poor ones. It is very expensive to treat NCDs because these are the lifetime diseases. Psoriasis Philippines, they have this rescue network. Patients in severe form, they will bring it to our institution.
So many dreams has been stolen by psoriasis. The mental health is very important for us to be addressed because a lot of us get depressed, get anxious. Many years ago, I've experienced the same thing. I lived like a hermit. It's very sad. We're going to rescue a boy tomorrow. So, 5 o'clock, pupuntahan kayo nila ng team. This is so severe.
Masakit na yan.
We'll try our best to save him.
Nalaman ko po na psoriasis ang sakit ko nung bata po ako. Nakapekto po ang karamdaman ko dahil hindi po ako makalabas po dahil nahiya po sa aking karamdaman. Pumapasok po ako dati pero napahinto po ako dahil po sa sakit ko. Nalulungkot po dahil hindi po ako nakapag-aral ng kagaya po na sa iba.
Usually, once we see the patients and manage them appropriately, we see drastic improvement for 1 to 2 weeks.
Masaya po ako at nagkaroon po ako ng klase ng lang. Masaya po sa kagaya ko. Hindi na po.
It's very important to talk with someone. It's like having a lifeline. Psoriasis is more serious than most people think. Patient must be helped. Policies must be crafted. You need to care for humanity. You need to care for their health.
Oh.
Ah,
Game.
and you are still watching Weekends with PsorPhil. We are your host tonight. I am Coach Jones.
I'm Doc Wang.
All right,
And
and
I'm
of course,
Robelle.
thank you so much, Doc Weng and Ma'am Robelle. So right now, our tonight's episode, still of course, it's COVID vaccines, lupus and scleroderma, with of course our hashtags. Ayun na nga, so WWP COVID vaccine. And by the way, hindi ko na patatagalin pa, Doc Weng and Ma'am Robelle. I know both of you are also excited to have our guest tonight. So our guest tonight is Dr. Juan Javier or Doc Jombi. We call him Dr. Juan Javier Lichauco. So he obtained his medical degree from the University of Santo Tomas. He pursued his fellowship training in rheumatology at Montefiore Medical Center and Albert Einstein College of Medicine. He then joined St. Luke's Medical Center, where he has progressed through several positions, including assistant professor at St. Luke's Medical Center, College of Medicine, and past chair of the Department of Medicine at the same institution. So he's currently the section chief of the section of rheumatology at St. Luke's Medical Center and the president of the Philippine Rheumatology Association. So, hindi ko na patatagalin pa. So, may I call on Dr. Jombi to join us on stage via on stage online or
Hi,
virtual stage. Hi po, good evening po, Doc Jombi. How are you po?
magandang gabi Coach Jones. Mabuti naman at magandang gabi din kay Robel at kay Dr. Weng at sa lahat ng ating mga tagapanood ngayong gabi. Maraming salamat for inviting me over.
Yes, thank you so much, Doc Jombi. It's really our pleasure to have you tonight. And right now, apart from the Psoriasis Philippines, other patient group organizations are here, collaborated. At gusto rin namin, ako gusto ko matuto, definitely sila Doc Weng and Ma'am Rubel. Gusto rin matuto yung mga patients, mga members din po nila about COVID vaccine and at the same time yung i-discuss nyo sa amin. So, Doc Jombi, we heard that you have a presentation that na ni-ready nyo po para sa amin. Tama po ba?
Oo, Coach Jones. Paul, if we can share slides. Konti lang naman itong slides na ito na na-prepare ko pero naisip ko kasi na maganda siguro kung ito muna yung ipipresent ko mga slides kasi mahalaga para sa akin na mabigyan namin ang ating mga kaibigan ng klarong mensahe tungkol sa paggamit ng pagbabakuna sa COVID-19. And then from there, siguro we can answer certain questions. Alam ko na mainit ang topic tungkol sa paggamit ng COVID-19 vaccine sa mga pasyente na may rheumatic disease tulad ng lupus, scleroderma at iba pa. Maraming katanungan, marami pa rin sigurong mga hindi pa natin alam, but I will do my best to try to answer your questions in the best way. So ito yung first slide and I wanted to share this slide because this is an infographic na ginawa po ng aming society, ang Philippine Rheumatology Association. At ang aming purpose nito is to just send two clear messages. Naisip kasi namin kung maraming ilalagay sa infographic, baka mawala ng interest ng tao. So, the two most important messages actually is that sa mga pasyente may autoimmune diseases tulad ng lupus, rheumatoid arthritis, at psoriatic arthritis, scleroderma at iba pa, pwedeng tumanggap ng bakuna laban sa COVID-19 para sa ganitong mga kondisyon, maliban na lang kung may kontraindikasyon na pwede natin pag-usapan maya-maya. No? And the second clear message is that makipag-ugnayan po kayo sa inyong rheumatologist kung meron kayong katanungan tungkol sa paggamit ng COVID-19 vaccine. Next slide. So ito po yung infographic po namin, no? And I'm sure that this, I think, is recorded, and hopefully you can also take a picture because we want you to share this message to everyone. No? So please share away. No? So ang aming next na mensahe is ito ang mga dagdag na mensahe na gusto po namin pong ipaabot sa ating mga kaibigan, na unang-una nga makipag-ugnayan sa inyong rheumatologist, no? There are maybe 1,000,001 questions that you have about the vaccine, and it's always good to communicate, makipag-usap sa inyong rheumatologist, because ang pagdesisyon tungkol sa pagbabakuna is a shared decision making between the patient and the physician. Makipag-usap kayo, because the best way that you can decide is if you have a clear understanding and knowledge about the COVID-19 vaccine at ang inyong kondisyon. Second important point at mahalaga pong mamensahe sa inyo is that base sa mga studies ngayon, alam namin na mas malaki ang peligro na ma-hospital dahil sa COVID-19 ang mga pasyente na may autoimmune disease. So the risk of getting bad COVID-19 na ma-hospital is higher in patients na may autoimmune condition, and this could be because of many factors, yung inyong immune system, especially because many of the patients are also taking mga medications na tawag namin is immunosuppressant. Nagbababa ng immune system ang ibang mga gamot namin, especially steroids na ayaw talaga namin gamitin for long term. But kapag mababang resistensya mo, then mas mataas ang risk na makapagkuha ka ng sakit. Third important point, which I think is very important, I'm sure that many of you still have that question in your mind, no? Ano ba talaga ang pinakamagandang vaccine? I also get this question from my patients. And my answer, which I know is consistent with the other responses ng ibang doctors, is walang best na vaccine. So magpabakuna kayo dahil kung ano man ang available na vaccine, kunin nyo na, because ginto ang panahon. And for every day na you delay getting the vaccine, you also have that delay na or increase in the risk na baka magkaroon kayo ng COVID, very bad COVID. So magpabakuna dahil mas maigi na may protection kaysa walang protection at all. No? At ang number 4 na konsepto na gusto ko rin ipaabot, kasi marami ata mga pasyente nag-iisip na pag napabakunahan na sila, pwede na silang magtanggal ng mask, pwede na silang pumunta ng mall, at pwede na silang bumalik sa normal lives na gustong-gusto naman nating lahat makamit. No? So even if you get the COVID vaccine, tuloy-tuloy pa rin ang paggamit ng mask, face shield, at physical distancing. So next slide. So ito po yung sinasabi namin na apat dapat. Ito po ay isang mensahe from the HPAAC, or the Healthcare Professionals Alliance Against COVID. And it stands for air circulation. Do not be confined in closed spaces. Kaya nga, di ba, kahit nga kakain o kakain sa labas, kung pwede, mag-take out na lang, or try to be in free spaces kung saan medyo mas merong distansya. Ang distansya sa bawat tao, at least 1 meter or more. Always wear your mask and face shield. At kung pwede, ang interaction between people should be limited. So 30 minutes maximum, or better kung less. I'm just going to the last 2 slides. Ito po ay hiniram ko po sa website ng Philippine Society of Allergy, Asthma and Immunology. Meron po silang website na pwede niyong puntahan, and you can download this. But this is actually parang infographic din, pero parang guide din, na kasi ang takot din, I think, ng ibang mga pasyente is about allergies. And so meron tayong protocol na sinusundan, kasi ito pong pagbabakuna, hindi naman po ito na basta pupunta kayo sa clinic at magpapabakuna kayo ng COVID-19 vaccine. Marami pong pinaghahandaan dito. one pa lang is logistics, no? Ibig sabihin, yung pag-storage ng vaccine kasi iba't ibang temperatura ang kailangan na ma-maintain para masigurado natin na hindi malulusaw at masisira ang pagkabisa ng vaccine, number one. Number two, meron tayong mga vaccinator. Ibig sabihin, meron talagang special training kung paano i-handle at i-prepare ang bawat klase ng COVID-19 vaccine. At pangatlo, observation at monitoring. Hindi po ito yung klaseng vaccine na pag napapakunahan po kayo ay pwede na po kayong umuwi kaagad sa bahay. Kayo po ay requested and required actually to stay in the center for at least 30 minutes so that you will be observed and made sure na wala pong reaction pagkatapos yung pong makuha yung vaccine. Ito po lang yung first of two slides on the recommendation po ng Philippine Society ng Allergy, Asthma and Immunology. Sa kaliwang bahagi, kung makikita nyo po, ay nakaklasify po ang pasyente kung low risk, moderate, or high risk na magpapakuna o makatanggap ng COVID-19 vaccine. No? So, kung wala naman pong mga allergies o may mga simpleng allergies lang sa food or oral medications, maaari naman pong makatanggap ng bakuna. Kung meron po kayong question, sometimes it is best to consult with an allergologist para mabigyan po kayo ng go signal kung pwede makatanggap ng COVID-19 vaccine or hindi. Ngayon, kung meron po kayong history ng severe allergy na talagang nahirapan huminga, talagang nagsara yung daanan ng tubo ng hangin sa loob ng 6 na oras mula sa ang tawag naming components ng COVID-19 vaccine. No? Kasi ang mga bakuna, meron din sila mga tawag nating adjuvants o mga ibang ingredients na nakasama sa vaccine. At dito, kung makikita niyo po, kung may history kayo ng allergy sa aluminum hydroxide or polysorbate, at kung ang reaction niyo po sa mga ganitong components ay nangyari na sa inyo sa loob ng 6 na oras, so ang pagkagrabe ng allergy is not just based on how bad the allergy was, but also how fast. So kung within 6 hours, and these are severe allergies, na nahirapan huminga o talagang anaphylaxis, na talagang bumagsak po ang blood pressure ng pasyente, hindi na po advised na makatanggap ng COVID-19 vaccine. And on the right-hand side, you will see naman dun na meron din pong guidelines na kung nagkaroon na po kayo o nakatanggap na kayo ng first dose ng COVID-19 vaccine, kung wala kayong reaction, pwede pong makatanggap ng second dose. Kung meron kayong mga mild reactions, pwede pa rin sa patnubay ng doktor. At if you can just show the last slide, I think na ang important lang sa last slide is kung makikita nyo po yung item 8 and 9 sa kanang bahagi, na kung may immediate allergic reaction within the first 6 hours that were severe, or meron talagang even immediate onset allergic symptoms within the first 6 hours after the first dose that are mild, no? So may mga hives, yung talagang mga pantal o mga rashes, ito rin po ang mga recommendation na it is best na to avoid getting the second vaccine, the second dose. Avoid getting the second dose of the vaccine in these situations. So, I hope that somehow nakatulong po itong mga guides na ito, and I just wanted to share itong mga ito po sa ating mga kaibigan. Maraming salamat po.
Alright, maraming salamat po Doc Jombi for sharing this insightful topic, and actually it's a very educational topic, especially there's a lot of patients or having this, or I can say na parang crying out for validation kasi there's a lot of questions running in their mind. I myself, sobrang dami ko iniisip on what if it affects me kung may allergy ako or whatever. So thank you so much, Doc. You mentioned about the name of the doctor, allergic something, ano po yun, Doc?
Opo. So meron kasi mga doktor ng espesyalista is on allergy. So yung tawag po
Opo.
natin sa kanila is allergologist. No? And so ang maganda naman kahit hindi naman sila ganong kadami pero ngayon kasi sa access sa internet if you can or if you have a friend kung may kaibigan kayo na may access. Ang very important kasi is marami kasi mga impormasyon na minsan kumakalat at hindi natin alam kung valid or scientific ang mga messages. So minsan nagkakaroon po kasi ng kaguluhan at hilo ng mga madla kasi hindi na nila alam kung ano yung pakikinggan at kung ano ang impormasyon na tama at hindi. So ang aking advice is always go to a site na medyo may integridad saka reliable ang information. And I think ang pinakamaganda is you always go to the website of the different societies kasi nakapost naman doon itong mga ipinakita ko sa inyo para meron kayong time para basahin yung isa't isang mga data na nakalagay doon sa kanilang mga rekomendasyon.
All right,
Kasi
thank you so much, Doc. I know.
Yes. Yeah, kasi yung sa aspekto naman kasi sa rheumatology no sa mga pasyente na ilagaan namin, isa siguro sa mga katanungan ay paano ba ito, 'di ba? Nagsi-steroids ako o umiinom ako nitong iba't ibang gamot, titigilin ko ba itong mga gamot na ito bago ako magpabakuna? No? So, ang masasabi ko is base sa datas na meron tayo ngayon, hindi niyo po talaga kailangan tigilin ng permanente itong mga gamot na iniinom ninyo. Kasi kung iisipin niyo nga, itong mga gamot ay mahalaga para nga makontrol yung inyong kondisyon, para masigurado natin na napapanatiliin nating tahimik ang inyong kondisyon na hindi siya nag-flare. No? Siguro ang masasabi ko lang is lahat ng mga gamot na iniinom natin, yung talagang siguro merong issue dito sa atin is prednisone or steroids. Kasi ang alam natin po kasi din no na ano ba ang prinsipyo ng bakuna? Kapag nakatanggap tayo ng bakuna, ginigising natin ang ating immune system para gumawa ng mga protina na ang tawag ay mga antibodies. At ang mga antibodies ang nagbibigay sa atin ng proteksyon para sa COVID-19. So, kung iisipin natin kapag umiinom tayo ng steroid, then itong mga gamot na ito nakakababa ng resistensya. So, sa aspekto naman na magiging effective ang aking bakuna kung nagsi-steroids ako, then ang katotohanan, alam natin na kapag mataas ang dose ng steroids mo, at ang sinasabi nilang, tinatali nilang kasing dose is kapag more than 20 milligrams ang prednisone na iniinom mo, maaring ang produksyon ng antibodies na pwede mong gawin pagkakuha mo ng COVID-19 vaccine ay mas mababa kumpara sa isang pasyente na hindi nagpe-prednisone or mas mababa ang dose. So, gusto ko lang kasi masabi na in the ideal world, sa isang perfectong sitwasyon, gusto natin na walang steroid ang pasyente o kung pwede sana, mababa ang dose. Pero ang katotohanan, meron talagang ibang mga pagkakataon kung saan hindi natin pa maibaba ang prednisone ng husto at you might need more than 20 milligrams. But hindi po ito dahilan para mag-delay ng pagkuha ng COVID-19. Sinasabi pa rin namin is that better to have protection than to have no protection at all. Kasi remember po, no, pag nakakuha tayo ng COVID-19 vaccine, hindi po ibig sabihin na zero po ang risk na hindi tayo magkaka-COVID. Pwede pa rin tayong makakuha ng COVID kahit nakakuha tayo ng vaccine. Kaya tuloy-tuloy pa rin ang paggamit ng mask, pagsuot ng face shield, hand washing at physical distancing. Pero ang benepisyo ng pagkuha ng vaccine is that kung man makakuha tayo ng COVID-19 na infection kahit nakakuha na tayo ng vaccine, mild lang ito. Hindi tayo mao-ospital. At yan po ang pinakamahalagang advantage ng pagkuha ng vaccine because ayaw nating ma-ospital. Kasi pag na-ospital tayo, ibig sabihin, ang COVID-19 infection natin is bad. At kapag bad ang COVID-19, mas malaki ang risk na magkakaroon tayo ng mga komplikasyon. So I hope that I was able to clarify yung issue na yun.
Hello, good evening po, Doktor.
Yes, Robelle?
Yes po, Dok. Tanong lang po, Dok, ng ating mga audience is, marami tayong mga patients who are rheumatic, who has pediatric rheumatic conditions. Meron na po bang vaccine na pwede po para sa ating mga pediatric patients?
Oo. So, ang sagot ko dyan ay lahat po kasi ng available COVID-19 vaccines ngayon ay na-test lang po sa mga adults. No? So these were patients who were 18 years old and older. Now, do not worry, wag po kayong mag-alala kasi sa ngayon hindi pa kasi recommended na itong mga available vaccine natin is to be given sa mga pediatric patients. Pero meron po tayong mga ongoing studies ngayon na tinetest din ang mga vaccines sa mga pediatric age group. And so these are patients who are less than 16 years old. And we know about the urgency. Alam natin na this is a very important information that we need to get fast. And from what I know is that as early as June, we will already have more information about this at mabibigyan po natin kayo ng tamang advice tungkol sa anong vaccine ang pwede for the pediatric age group.
Doc,
Kasi
I
ang
have a
habol kasi natin
question.
palagi is, sorry, ang habol kasi lang natin is when we give something, we want something that is effective and safe. And we have to have that information, the best information we have bago tayo maglabas ng advice tungkol dito. Yes, Weng, sorry for the interruption.
No problem, Doc. Doc, kasi ako nakapagpabakuna na po ako 2 days ago. Dahil po considered akong frontliner. Pero kadalasan natatanong ako na yung sakit ba namin magka-qualify para maging priority. Tama po ba na sinasagot ko sila na priority tayo kasabay ng mga senior kasi ang sakit natin at katulad ng ibang autoimmune disorder considered comorbidity. Tama ba, Doc?
Yes.
So dapat talagang ilagay tayo sa priority?
I totally agree with you, Weng, and that you are yung ating tawag ko dito population ng pasyente natin na may autoimmune condition is priority, no? So gumawa kasi sila, nag-antala sila kasi ng iba't ibang kategorya ng priority. And of course, di ba, alam naman natin, inuna muna yung mga frontline healthcare workers or those employees that are working in the hospitals. And then susunod dyan yung mga senior citizens at saka ang mga pasyente na may comorbid condition. At kasama doon sa comorbid condition, ang mga pasyente may autoimmune condition. Siyempre, it would have been ideal kung ang proseso ng pag-roll out ng vaccine could have been better, definitely. But yes, I think that we are doing our best with the current situation natin. But we hope that we can have these vaccines available soon so that we can also give these vaccines to our priority patients. That kayo po yun.
Thank you, Doc.
Doctor, good evening po ulit. Most of our patients, madami sa atin sa Pilipinas ang merong lupus nephritis. So mas madami sa kanila ang mas madaming immunosuppressants ang iniinom nila or yung iba pa naka-cyclophosphamide infusion or biologics. Meron po bang mga special protocol or restrictions or anything na kailangan payo po muna na gagawin nila before having themselves vaccinated with COVID vaccine?
So I think that because high risk nga ang mga pasyente natin, so yung apat dapat na precautions, tuloy-tuloy po natin gagawin po yun, no? Number two, meron lang po kasing isang guidelines galing sa American College of Rheumatology kung saan nabigyan din tayo ng payo kung ano ang gagawing timing between the vaccine at sa mga gamot na nakukuha at tinatanggap ng mga pasyente. Ang aking comment nga lang is that itong pong advice na ito is based on the available vaccines na nasa US. And unfortunately, the vaccines that are available in US for now, hindi pa to available sa Pilipinas. No? So, yung Pfizer at saka ang Moderna vaccine ang pinagbasehan ng mga guidelines sa US. But both vaccines are yet to come. No? Padating pa lang to sa Pilipinas. Pero kung susundin natin yung kanilang payo, for the most part, wala pong kailangan na adjustment sa pagitan ng pagtanggap ng vaccine at pag-inom o pagkuha ng mga gamot na ito. Siguro ang mga tatlong gamot lang na may isip ko na medyo may konting pagbabago lang sa pag-modify ng iyong pag-schedule ng pag-inom ng gamot is methotrexate. At base doon sa guidelines, sinasabi na kung napabakunahan ka, then i-delay mo ang pag-inom ng methotrexate ng 1 week after your vaccination. Ito rin po ang payo sa mga pasyenteng tumatanggap ng IV na cyclophosphamide. So, alam natin po na ang cyclophosphamide IV ay ginagamit para sa mga pasyente natin na may lupus nephritis. At ang recommendation din ay kung makatanggap ng vaccine is kung pwede, i-delay mo lang ng 1 week ang pagtanggap ng inyong IV cyclophosphamide. At sa mga pasyente natin na nakakatanggap ng isang gamot na ang pangalan ay rituximab, ito po ay isang biologic drug na ginagamit natin sa lupus o rheumatoid arthritis. Ang sinasabi din dito ay kung pwede magkaroon ng pagitan ng mga 4 na linggo o 1 buwan sa pagitan ng vaccine at pagtanggap ng rituximab. But for the other medications, sa ibang gamot na ginagamit ng mga pasyente, wala pong kailangang pagbabago sa pag-schedule.
All right. Thank you so much, Doc Jombi. Doc Weng, Ma'am Robelle, do you have other follow-up questions po ba kay Doc? Or any other questions po? You can ask pa naman po.
Last na lang akong question kay Doktor.
Sure.
So, kasi Doc, syempre, kahit na minsan, kahit na anong sabihin natin, di ba? Meron tayong concern, for example, on the efficacy of the vaccines. Para po sa isang lupus patient na matagal ng lupus patient, madaming iniinom na gamot, and then, suddenly, biglang ito yung time na maganda yung pakiramdam mo. So hesitant ka kung tatanggap ka ba ng vaccine kasi baka mamaya ito pa yung maging dahilan ng pagkakasakit mo. Kasi syempre hindi ka sigurado. Ano po Doc ang inyong mapapayo at masasabi para sa mga patients na hindi pa rin kumbinsido na magpabakuna?
Magandang tanong yan, Robelle. At siguro para din sa ating mga kaibigan tulad ng mga kaibigan natin from Scleroderma Sisters, Dr. Weng, no? Ang pinaka best way ko para maisagot yon is that meron kasing naintindihan ko yung takot ng ibang pasyente kasi hindi ba pag binigyan ka ng vaccine, so ginigising mo yung immune system mo. And so ang risk na pwede mangyari dyan is that kapag na-activate naman o nagising mo ang immune system mo, baka mag-flare yung sakit. Ito ang isang bagay na kinukuha pa natin ng mga datos, no? Kasi ang katotohanan, itong vaccine na ito mabilis na develop at konti lang pa rin kasi ang ebidensya na nakikita natin tungkol sa risk na ito. Kaya ang ginagawa natin ngayon is active reporting, no? Sa darating na mga buwan at taon, yung data na kinokollect natin tungkol sa mga side effects is very important because dito natin makikita kung talagang totoo ba itong pinangangamba ng ibang pasyente. Dahil so far sa ating ebidensya, hindi pa natin po nakikita na nangyayari ito sa mga pasyenteng may autoimmune condition na nakatanggap ng COVID-19 vaccine. Kung meron man, napakakonti na hindi mo pa masisigurado na meron talagang koneksyon ang pag-flare at pagtanggap ng COVID-19 at pagkakaroon ng flare ng condition. So, my message pa rin is that kung ititimbang mo ang benepisyo at disadvantage or side effect ng pagtanggap ng vaccine, mas malaki di hamon ang matatanggap mong benepisyo. Kaya ang recommendation pa rin namin is please get your COVID-19 vaccine. So I'm sure marami pang tanong ang mga tao, pero siguro sa loob ng siguro 1 hour, I hope that at least nakapag-send ako ng clear message. Maybe not all questions can be answered, pero at least yung mga major points na discuss natin ngayong gabi para at least mabigyan natin ng confidence ang ating mga pasyente para makakuha ng COVID-19 vaccine.
Doc, may question and then kailangan ko lang ng confirmation mo or pangdiin. Kasi ako po isang dentista na may scleroderma, kaya po ako nabakunahan. Pero ang lagi ko nga sinasabi sa mga nagtatanong sa akin, bakit ako nagpabakuna? Ang lagi kong sinasabi, mas takot ako sa COVID kaysa sa allergy. Kasi yung allergy may gamot, pero yung COVID wala. Tsaka po para sa akin na may lung involvement na dahil sa scleroderma, takot na takot ako sa COVID. Kaya nung nagkaroon ako ng pagkakataon na magpabakuna, kinuha ko na kaagad yung pagkakataon. Kaya, Doc, paki-stress na lang yun. Kasi kadalasan po natatanong ako doon na talaga nagpabakuna ka? Safe ba yan? Ako po, I have full confidence sa mga doktor. Kaya yung sinasabi nyo na nagtanong ako sa doktor, ginawa ko po lahat yun. Hindi lang ako nagtanong, nangulit pa ako ng medical certificate kasi pag hinanap sa akin sa vaccine center, may ipapakita ako. Kaya yun, Doc, siguro yun yung magandang idiin mo, Doc, sa mga nakikinig tsaka sa viewers natin na okay, magpabakuna kahit na meron kaming mga autoimmune disorders.
Salamat, Weng. Tulad nga na sinabi natin nga kasi, ang taas kasi ng risk na kung magkaroon tayo ng COVID at meron kayong problema sa baga o ibang parte ng katawan, mahirap magamot ang COVID, matagal ang recovery mula sa COVID, at ito ay madali nating iwasan kung magpapabakuna tayo. Naintindihan namin, hindi naman namin sinasabi na walang side effects ang lahat ng bagay. Hindi kasi tayo living in a perfect world where it's either ang isang bagay ay totally effective for all patients or in terms of side effects na 100% walang side effects sa lahat ng pasyente. Maganda sana at mapaginipan na sana mangyari yon, pero in reality, sa totoong buhay, hindi nangyayari po yon. Pero it's always about calculation ng risk. Ibig sabihin, we can manage the side effects. Kaya nandito ang doktor para tumulong sa inyo. Kung man meron kayong mga history of allergies, if these are very mild, tulad ng pinakita ko, hindi po yon contraindication or pagbabawal na hindi nyo na pwedeng tanggapin ang COVID-19 vaccine. And as what we had said, ang pagkuha ng vaccine is in a monitored setting at may mga doktor na nagbabantay po sa inyo para nasisigurado natin na ligtas po kayo sa anumang paghahamak or any danger. So again, as we had said before, the benefit outweighs the risk. Mas marami pong benepisyo sa pagkuha ng vaccine, kaya tanggapin po natin ang COVID-19 vaccine.
All right. Thank you so much, Doc. It's really a privilege to have you tonight. We've learned so much. I representing psoriasis, si Doc Weng representing Scleroderma, and si Ma'am Robelle representing those lupus group. You made us realize that there are really things that we have to consider before we take the vaccination. And I remember, ano ko lang, I'll try to echo what you mentioned earlier, Doc, na even after taking the vaccination, there's still a possibility, of acquiring the condition. So still continue wearing face mask or face shield, and social distancing is very, very important. And one most important siguro is always consult. I remember parang na-flash nyo po, Doc, kanina is yung share decision making. Tama po. So it's really important that you are here to us, having those statements to make it clearer for us to decide properly whether we'd like to take it or not. But I think 100% siguro, tulad nga ng sabi ni Doc Weng, tapos yung mga frontliners nag-start na, and eventually, tama ba Doc Weng, by June or ano, yung mga may autoimmune condition, magkakaroon na rin ba?
Tama po, nakasunod na sila sa pagkakatanong ko, pagkatapos naming mga medical frontliners po, ang susunod na yung barangay health workers, tapos yung senior citizen, tsaka po yung mga pasyenteng may comorbidity.
Wow, that's really a good news, or siguro it's really good to know those. Talagang dapat we really have to look forward or probably mark our calendar, tama ba? So that everyone should prepare themselves. Kasi sabi ni Doc kanina, you have to really prepare yourselves, lalo na we're taking systemic medication. So once we know na, ayan na, we really have to boost our immune system. Anyway, Doc, thank you so much. Do you have other things, or would you like to promote, or how they can reach you po ba?
Yeah,
Anything you
so
have for the viewers po?
we're always here to help. Nandito po kami lahat always para makatulong sa inyo. Maraming salamat ulit sa pag-imbita, kasi ito tingin ko ang isang mabilis na paraan para ikalat ang impormasyon para sa ating mga kaibigan. No? Visit also our website kung may pagkakataon. At ito po ang isa ring paraan para ma-update po ang ating mga pasyente tungkol sa ating mga rekomendasyon. At pinaka-importante always is makinig palagi sa eksperto para mabigyan po kayo ng tamang advice tungkol sa mga bagay-bagay po na ito. So, I wish everyone always continued safety and health, especially during these times. At sana po ay dumating na po ang panahon na makikita po ulit tayo ng personal. Marami pong salamat.
Thank you so much, Doc Jombi. So, by the way, I'd like to also give opportunity to Doc Weng or Ma'am Robelle. Would you like to probably say anything? Siyempre sa group nyo, would you like to also invite them to take the vaccine? Kayo po, would you like to say anything to our viewers or yung mga followers or group or organization nyo na nanonood po ngayon?
So thank you first to PsorPhil and Dr. Jombi for taking time to help our patients, to educate our patients on education on vaccine. Importante sa atin na we are well informed on our decision, kaya hindi lang siya, it's actually a good relationship between the doctor and the patient kung paano magkakaroon ng tamang decision on getting the vaccine or not. I'm actually scheduled to get my vaccine tomorrow, so hopefully you call your doctors to get their to ask if you are allowed to get the vaccine. Marami pa rin tayong syempreng questions, kahit yung mga doktor natin mismo may marami pa rin questions, pero isa lang ang isipin natin na they wouldn't give an advice na makakasira at makakasakit sa atin. So hopefully you will have a clear mind and an open mind tungkol sa vaccine. Thank you.
Ako po, I had my vaccine 2 days ago. So far, wala naman po ako masyadong side effect except po sa masakit yung site ng injection and parang magsisinat lang siya, nagparacetamol lang ako. And then, we'd like to invite the viewers bukas. Meron po ulit tayo weekends with PsorPhil, same time at 8 p.m. It's COVID vaccine, this time COVID vaccine and arthritis with Dr. Evan Silverio Vista, or we call him Dr. Evan, and with the engineer Clark Ferrer from the ASAP group, the Ankylosing Spondylitis Association of the Philippines. So, see you tomorrow, same time po, 8 p.m.
All right, thank you po.
Also, we would like to acknowledge our sponsor, Novartis Philippines.
All right, thank you po, Novartis Philippines, for always supporting our episodes. And we would also like to announce to our viewers right now, I know most of you are looking forward to the winners. We actually promised you earlier that we have amazing surprises, one of which is one box of vitamins and one is the t-shirt. Of course, we're going to announce that tomorrow. So please stay tuned hanggang bukas. Actually, hanggang sa mga susunod, hanggang Sunday, because we prepared a lot for you guys. So, ayun, we're going to announce the winners tomorrow. I-check lang ng DTI namin. Yes, may literal kaming DTI na kasama ngayon. Ayun, so of course we are simultaneously live on Facebook and YouTube. You can still catch tonight's episode, of course, from our official Facebook fan page, Psoriasis Philippines. And of course, check our YouTube. Simply search PsorPhil channel. And of course, don't forget to subscribe and hit that notification bell. So you'll, of course, be notified with our future episodes. So thank you so much. We learned a lot, Doc Jombi, and we also learned a lot from these lovely ladies in front of me who joined me tonight. Thank you for your heart, for empowering all your members. Maraming salamat po.
Maraming salamat.
Thank you din.
Thank you, Weng.
Alright, so
John.
maraming
Thank you po,
pong salamat. And before we end, I'm gonna ask for our fellow people from the backstage, our tech team, to join us on the screen. Alright, so again, marami pong salamat, Ms. Robelle, Dr. Weng, and Dr. Jombi. Thank you as always na lagi niyo po kaming pinagbibigyan pag naimbitahan po kayo. So, yon, see you po again bukas po ng gabi as we discuss another interesting topic. Kumbaga, continuation lang po ito ang usapan natin on the safety of COVID vaccine. So, see you again tomorrow mga ka-weekenders. Good night everyone and thank you for tuning in. See you tomorrow. Bye-bye.